Hello, today I'm going to be doing a self-breast examination education. So just to start off, it's recommended for you to do this examination a week after you stop menstruating. Preferably, you should be on the same day on each month so that it's consistent and you keep track if there are any differences or lumps in your breast. So to start off the examination, it's recommended to first take a look at yourself in a mirror, stand up straight, and put your arms to the side and just see if you see any differences, any visible lumps, just to get a visual examination of them. So in the mirror, you should be looking for any of these following changes, such as changes in shape and size, dimping or puckering in the skin around the nipple or of the nipple, some type of rash, skin redness or soreness, if there's an unusual swelling in one of the upper arms, or any accentuated veins on the surface of the breast. To have a better visual field of the breast, it's recommended to raise your hand above your head and then press your hands on your hips. That way it will be easier to visualize any changes on the breast. To actually feel for any lumps, it's recommended for you to lie down. This is due because the breast tissue spreads out evenly when lying down, and that way it's easier to feel any lumps. Make sure that when lying down, you place a pillow on your neck, and then to examine one side, you have to extend the elbow outwards and place your hand under your head, and then your other hand will be doing the palpation and inspection. To actually start palpating around your breast and on your breast, use 3 pads of your fingers and apply pressure to feel in the breast, and make sure to do it in a circular motion, and start off with a light press, a medium press, and then a firm, a little bit stronger press to really feel inside the tissue. When palpating the breast, make sure you go in a clockwise position and in circular motion around the breast. And then to feel any lumps in the underarms, just put your arms to the side, and with one hand you would do overlapping small circular motions to feel for any lumps. So similar, just circular motions, and then press lightly, and then a medium press, and then a more firm press to really feel inside the tissue. So after you do one side, do the same thing vice versa on the other side of your breast and your underarm to check for any lumps. All right, now I'm gonna be doing teaching on how to check for your testicles, for any lumps or any abnormalities on them. So it's recommended for men to check and palpate their testicles regularly. It is recommended to do it in a warm bath where everything is relaxed, and it'll be easier to palpate for them. And you should always start with one testicle and then move on to the other, not both at the same time. That way you can really feel if there's anything abnormal on them. So it is completely normal for one testicle to be lower than the other. This is just a natural thing. Usually the testicle that is at the highest, the penis will bend to the other side. So you should grab your testicle and cup it with your hand, and your thumb should be at the front of the testicle, and then with your forefinger and middle finger you should put it in the back of the testicle. That way you move it around and you feel it for any lumps or any abnormalities. Having the thumb and the pointer finger in the back and the thumb in the front, this will allow you to roll the testicle, and that way you really feel in the tissue if there's any abnormalities. When palpating, you should feel it to be smooth, to not there be any lumps. Really, the rolling motion should be smooth. So at the bottom of the testicle, you should be able to feel a sperm carrying kind of bag. It's kind of a knot, so that is completely normal. It's usually at the bottom of the testicle. So if you do feel that, that is normal. Through the testicle, there should be a sperm carrying duct, and then at the top of it, there should also be that same kind of duct. Those feelings are normal. Sometimes it might feel a little lumpy on that side, but if you feel anything at the top or the bottom, most likely it'll be that knot and sperm carrying duct. And once you're done with that, with one testicle, make sure you change to the other side, and then go ahead and feel around and do the same. Thumb at the front, and then the 2 fingers on the back, and then just a rolling motion to make sure everything is smooth.